is a recreational drug, and there is the element of euphoria. And my position legally has always been, what's wrong with feeling better when you're sick? And what right does the government tell you to, avoid a mechanism that can make you feel better? When you're ill, you'll do whatever you need to do. And one of the reasons why these cases won in court is because judges are older people and they understand illness.
It's the old dope peddler, spreading joy wherever he goes.
It would cut the cost of official drug policy by 2/3, vastly increase the number of cures, redirect billions of dollars into respectable commerce, and financially slice the most dangerous criminal elements off at the ankles.
From the Zoomerplex in historic Liberty Village, The Zoomer with Conrad Black and Denise Donlan.
Greetings, everyone. Welcome to The Zoomer. Today on the show, pot and medical marijuana. Now, 6 weeks ago, pot was legalized in Oregon and Washington, and in Canada, Liberal leader Justin Trudeau has admitted to not only smoking, but also inhaling the scandal it caused. Look at that. There's merchandise already out. See? I'll let you, but you can have those. Justin Trudeau says pot would be legalized if he forms the next government, which is somewhat contrary to the Conservative approach.
Yes, well, Stephen Harper has been an asthma sufferer all his life, and that may accentuate his hostility to marijuana. I wouldn't know. We're all unlicensed psychiatrists, Doctor. The government has announced heavier sentencing, mandatory sentencing for unauthorized growers of more than 6 plants. But they are also changing the rules on use of medical marijuana.
So there's no question that pot's reached new tipping points, really, from counterculture to mainstream to medicine. And we're going to unpack all of this for you. Let's roll up the topic. Pot, weed, ganja, the chronic, cannabis. Comes with a lot of names and even more opinions. The Supreme Court's ruling on medical marijuana is roll it out. With the right prescription, it's your constitutional right. But some doctors think that's not so right. And now we pause for a brief history of medical marijuana in Canada. It was introduced in 2001. By 2002, there were 477 authorized users. Last year, there were 37,000. By 2024, that number is projected to be 433,638. Exactly. Patients can grow their own, buy from small-scale grow-ops, or directly from Health Canada. That is, until April 1st. The feds have killed 2 birds and got stoned. The Harper government says you can't grow at home, and we won't grow it for you. Medical marijuana production will now be weeded out to licensed commercial growers rushing to get a piece of what will become a multi-billion-dollar business. Big oil, big data, and now big reefer. We've gathered some leading thinkers on cannabis around the round table today, and we're going to explore legalization in a few minutes near the end of the show. But right now, let's dive into medical marijuana, which is said to help with arthritis and epileptic seizures, cancer, pain, attention deficit disorder, glaucoma, Parkinson's. Dr. Schechter, you were a skeptic, I understand, at the beginning. What happened to change your mind?
I was a skeptic when I first started practicing medicine and when I was a student, and under the tutelage of some other physicians who were more familiar with cannabis, I understood that it had a therapeutic value, that we could use it as another tool in the physician's toolbox. And once I started practicing on my own, I had patients come up to me and tell me about their experience with marijuana and how it allowed them to ease their suffering with various ailments and also reduce the amount of narcotics that they're using.
Well, you have a patient right beside you, perhaps not your patient, Tracy.
Yes.
You use medicinal marijuana. How does it work for you?
Yeah, I've been a diabetic for 34 years. So I have painful cramping in my legs and in my feet. And I've tried a bunch of different therapies. I've been on a lot of pharmaceutical drugs in my time. At one point, I was on 13 pills a day and 5 injections. I'm now down to 3 pills a day. My 5 injections will never change. But I've added cannabis to that regimen, and my quality of life has completely changed. My quality of life in my 40s is double that of what it was in my 20s.
Does marijuana alleviate leg cramps?
Yeah. It doesn't alleviate them completely. I look at my pain on a scale, so if my pain is at At a 9, I can smoke a joint or vaporize or eat a cookie, and usually bring that down to about a 2 or a 3, which is bearable.
There's really strong anti-inflammatory properties, known that. And this is not a recent discovery, by the way. We're talking like we just discovered this, okay? Right. This is thousands of years of information that got repressed or suppressed by governments when they wanted to outlaw recreational use. And every patent medicine at the turn of the 19th, 20th century had cannabis in it. It was seen as a panacea. So we're just acquiring lost knowledge. And for doctors to say, well, we don't know about it, it's because it really was swept under the carpet for 50, 60 years.
What are the dosages like?
So the dosages for a typical dose for a medical marijuana user is usually between 1 and 3 grams a day.
Tracy, show us what a gram is, because it's been
I'm going to have
30
to eyeball
years since
this
I
a
looked
little
at a gram.
bit, but I would say that this is probably about a gram.
Sarah, what's your story?
Chronic pain, cancer patient 25 years ago. I have a transplant pelvis, left side, so chronic pain for 25 years. I've walked with a cane, and my choice are hardcore pain meds, which are so destructive to everything else in the body, or a quality of life with cannabis. So I use a combination of both. And I really notice the difference when I have to leave the country and rely completely on pharmaceutical drugs. All of me starts to shut down.
How was it for you to change your mindset, right? Because there's always these associations that come with people who smoke weed, reefers, they're always on the couch. And I would think that it would be really hard for you to take that therapy on yourself because there's such bad PR.
Yeah, there's a stigma
There's
attached
a stigma
to it.
attached. I taught school. I have 3 kids who are all professionals, post-grad degrees, and the stigma is, I don't look like what you would assume as someone lying on a couch smoking marijuana, and I've worked with raising large sums of money, and it hasn't impacted on that. It's allowed me to function and carry on with the day. If you think of pain as being something here that's always in the front of your face, pain meds will actually remove it, so you go on with things that you shouldn't be doing. And the cannabis moves it just over here.
Well, I came into marijuana differently. I had a prescription for Demerol when I was 17, and then it wasn't until my 20s that I started using medical marijuana. So I learned really quickly that it was it was way better. It was not addictive. It made me feel better. And as you just said, like, it really lowers your pain, so you're functional. Mm-hmm. Narcotics make you unfunctioning. And with medical marijuana, I can become functioning. I can become able-bodied, I guess, where I feel disabled a lot. So marijuana takes that dis part and makes me abled. So I feel that is a good...
It is. And then when you say dis and able, it's also disease and at ease, the body at ease, and we are not. We are ill at ease.
See, everyone wants to talk symptom control, that's important, but you forget, it is a recreational drug, and there is the element of euphoria. And my position legally has always been, what's wrong with feeling better when you're sick? And what right does the government tell you to, avoid a mechanism that can make you feel better? When you're ill, you'll do whatever you need to do. And one of the reasons why these cases won in court is because judges are older people and they understand illness. It's probably the only area of law I've been really successful in, because I'm actually making arguments to people who understand I want to make choices about my medical care, even if conventional society frowns upon it. So, I mean, there's nothing wrong with being a little bit higher euphoric from the THC. That helps in terms of the therapy also. For some people. For other people, it makes them anxious.
Right. Alan, I think this is all your fault, going up there and challenging the constitutionality. Is that the law is kind of ahead of what normally would have been medical protocols, I expect.
Oh, no question. Yeah. I mean, it's an unapproved drug. There weren't the 4 phases of clinical trials to get drug approval. The one thing we knew is it was working for certain types of symptom control. The mechanism, we weren't clear.
Neve, you run a compassion club. What's that all about? So
dispensaries or compassion clubs happened as a result of the need for medical marijuana, but there was no functioning program. COM has been around since 1996, and the medical marijuana program has been around since 2001. So dispensaries offer a gap to the constitutional issues that arise. So,
but it's kind of it's a gray area, right?
It is a gray area.
The police kind of look over here.
It's unregulated.
Yeah.
Right, and we've been saying we need regulations, we need to work within the system so that the most number of people can be helped. Since '96, we've processed almost 4,500 members.
4,500 members, wow.
Not thousands, but hundreds of studies have been developed over the last decade or two,
Right,
confirming the anecdotal evidence. So for doctors and the medical associations say, no, this is really smoke and mirrors, they're not looking very carefully.
Well, we have a doctor, actually, and I'm just going to show you a piece of tape, because in April, of course, Canadian doctors will have the responsibility to prescribe medical marijuana, but there is, of course, some doubt among the doctors. So let's see what Dr. Zach has to say. What's your sense of how effective it is?
Well, I think it definitely has effectiveness. The question is it better than other medications that we have on the market? And the problem is that we don't have the great studies. There's certainly good evidence for certain things, you know, and I've seen it certainly in cancer patients and HIV patients, people with certain types of pain. From what I read, there's about 40,000 people who are using now medical marijuana, and that it's expected to increase by like tenfold in the next 10 years. And so hopefully along with that, in addition to just, you know, more experience, people having more experience with it and doctors having more experience prescribing it, hopefully we'll have more data as well to say, okay, it is really effective for these conditions, and it's less effective for these conditions, you know. The other thing that we don't know that well is the potential downside, you know, the side effects, because everyone talks about them. You know, there's all sorts of things that are thrown out there. There's amotivational syndrome, and there's psychosis, and there are other different things. There's different kind of cancers that they've linked with it, but there aren't great studies about it.
I really don't like hearing doctors talk about the side effect issue. Billions of dollars was spent to prove marijuana is harmful. They couldn't prove it. When you take any of the pills you may have in your handbags and look at the side effects, you'll be shocked to see what's listed and look at the side effects that have been proven with marijuana.
The psychosis thing bugs me too. Because they're all awesome, always talking about cannabis and schizophrenia. Well, if that were true, Canada has a very large community of recreational marijuana users, and we do not have an elevated rate of schizophrenia in this country.
It's been consistent.
And so, I mean, if you're just looking at the hard data, it doesn't make sense. It just...
Well, no drug's been studied more over history, really, than this drug. I mean, there's been more money put behind it. The United States has tried and tried again, and anybody who comes up with positive results, they're removed from the position.
We talk about the negatives or the unknown part of cannabis, or what are the side effects. When I was in Israel, I met Dr. Meshulam, who discovered THC and CBD, and you know, as a neophyte, it's like, you know, what's the really bad thing? What do you think about us losing our memories or some of the negativity heard? And he looked at me and said that it's as important to forget as it is to remember. And he's speaking from Israel, where there's a lot of PTSD, and these are, you know, real things that we should consider in the new cannabis versus what was marijuana or pot before, because this is a medicine, and there are companies that are taking this very seriously, and the safety factor is something that needs to be brought into the new discussion.
Right. Well, we're going to get into the nitty-gritty of the new regulations coming into effect on April 1st, so stay with us. Engaged audience today. I want to introduce you to Max. How you doing, Max?
Fine, thank you.
Good. And you use medicinal marijuana?
Yes, I do. I have neurogenic pain. I'm a spinal cord injury, and what triggers my pain is pressure. Unfortunately, so just sitting, lying. I've tried all sorts of anticonvulsants, antidepressants that work for neurogenic pain, and it helps me take just a little bit of an edge off.
Now, I understand you live in a long-term care facility?
Yes.
Yeah. And do you smoke in the dining room?
Health Canada sent with my license information stating I am not allowed to smoke it in a no-smoking area or near the entrance of a main building, etc., and to use my judgment and not being foolishly obvious in and parading it.
Well, Max, good luck with managing your pain. Okay.
Thank you very much. I appreciate being here.
Who do we have here?
I'm Naomi.
Naomi, what would you like to share with us?
I'm still working. I'm 66. I'm a registered nurse. and I'm looking after one client who is severely disabled, and the only reason I'm capable of doing this is because of cannabis. Yeah. And this machine here is a vaporizer, which I was allowed to use in the hospital. I ended up as a patient, sorry. And this, they allowed me to use it. It was amazing, just amazing. And my social life, oh my God. I go to raves, people, and I dance, okay?
Naomi is living the life, okay. Okay. Paul, you are a marijuana user. What's your story?
In 1997, I had spinal fusion done. They put 4 titanium screws in my spine. During my recovery, one of the screws snapped and the broken piece is still embedded in my spine. Over the years from 97 till 2001, when I had an additional surgery done, I was taking copious amounts of different narcotics, OxyContin, Demerol. I've smoked marijuana for years. I never knew the medicinal values to it. I haven't taken a narcotic in over 11 years. I'm a husband, a father, a grandfather. I run a business, and I'm living proof it's not a gateway drug. I was taking OxyContin by the handful, and now I only use cannabis. Anybody that says that cannabis is a gateway drug does not know and has not done the research that needs to be done in order to be able to realize and find out this plant cures 100%.
So we invited the Canadian Medical Association to join us at the Roundtable, and they chose not to provide anyone. But this is what the CMA had to say in July of 2013. Asking physicians to prescribe drugs that have not been clinically tested runs contrary to their training and ethics. The use of medical marijuana has grown because there aren't better treatments for people battling chronic pain. The federal government will not help address this lack by abdicating its responsibility and to protect the health of Canadians. And we know that there was a recent Ipsos Reid poll conducted for the CMA earlier in 2013 that found that 85% of Canadians believe that medical marijuana should go through the same rigorous testing and approvals as other medicines. Alan, what's going on?
Well, you know, marijuana will never go through the clinical trial testing because a plant has problems in terms of patents, and pharmaceutical companies live off patents. That's why it's not an approved substance. So what's happening is, because it's not an approved substance, Health Canada had a program that was dysfunctional, though it did allow people to grow for themselves, and that was good, but really it wasn't working, it wasn't good patient access, and there was a lot of diversion. So they've tried to make it as equivalent as they can to a regular drug. So now there are licensed producers who have quality assurance requirements and security requirements, and now can grow multiple strains and offer it, hopefully at a price that will be very receptive to patients. So it's moved close to a pharmaceutical model, except it won't be sold through drugstores, it'll all be mail order. So it's a formalization of a program because the first program was a disaster for Health Canada. What will happen in the future, I don't know. There's a challenge to the new program to keep the old program, even though everyone complained about the old program, now we want to keep the old program.
So the challenge would be by people who used to grow it themselves?
Yes.
Because they expect the price is going to go up. Is that the argument?
They claim they can't.
Yeah, if you're growing it yourself, it's remarkably cheap.
It is cheap, but no one's really done the costing out to know exactly what it costs them.
I hate to be such an ignoramus here, but is there a real difference, variance in quality of growing? I mean, obviously you're a quality.
There's so many factors. You know, when we think about things like we're looking for mold, fungus, bacteria, E. coli, and these are things that quite honestly can be really detrimental to our health.
I'm not aware that there's ever been a huge issue of people getting sick from smoking moldy marijuana. I'm not aware of it. However, quality control is important.
You don't want to be smoking mold.
No.
I don't think there's any debate about that.
It was with a lot of people living with HIV/AIDS, with immune impairment. And I used to sit there like, is this a time bomb waiting to happen, that they're going to get some mold on pot and get sick? And it never happened. But I'm happy now that there are protections
somebody
in place.
in my position, if I smoked mold, it would be pretty detrimental to my actual career. Mm-hmm. So, I mean, I think that it'll be interesting to see where it goes in terms of what is a viable option for somebody who can't actually inhale, like, I'm not going to say toxic because everybody's going to jump on me about it being a plant, but it's smoke.
As a physician, I feel more reassured about prescribing cannabis, about being able to present it as an alternative modality to my patients, knowing that it's grown in a safe environment, knowing that it is going to be tested for the amount of cannabinoids, meaning how much THC and how much CBD.
So lower THC, higher CBD.
So as a
more
physician,
medicinal.
For
certain people, for certain variations.
You can have a lot of variations, and people will discover the strain specificity of their use. And quality is very important, because when the government first contracted for a prairie plant system, now called CannaMed, to grow marijuana, nobody liked it. And they could only take 15% of the market share of the people in the program.
So, Mark, you're producing the Rolls Royce of marijuana.
and multiple models as well.
If I may say, are other people at the table and in the audience familiar with the TV program Breaking Bad?
No, never heard of it.
Because, no, the reason I ask is that the last person you spoke with, the gentleman in the green shirt, looks a bit like Walter White, and I think you're saying you're the legally authorized Walter White.
Except that we're not trying to create necessarily something that will give people a high, or we're looking to provide a platform that science can attach themselves to, and we can develop some confidence behind this medicine.
But will Tracy say of you, if she gets her product from you, he's a genius, like people said of Walter White?
Actually, it's funny you mentioned that, because the grower that actually grew this strain, he's actually called it Heisenberg.
Well, he was a great scientist.
But at the same time, I mean, like Denise said at the beginning of the program, you will eventually have to follow the money, because there will be branding. You will feel like you're paying for packaging.
That's the way it's going.
Well, we're going to talk about legalization in a minute, but I just want to sort of get two things down for us right now. So the impact on doctors, on users, on businesses, big businesses, and this is going to put you out of business, perhaps.
Very well.
Right.
If the program works.
So are you feeling happy about the new legislation?
Well, it's a bit of a mixed bag. The program has to work, and it has to work for all Canadians. And right now, I believe Peace Naturals is no longer, or that you have a cap on how many people you can take in.
Well, we haven't.
He's sold out on a lot of products.
We've been. The numbers are higher than what we know and what we expected, but there's also that people buying maximum amounts because there's a fear factor. There aren't other people out there. That being said, no, we still are taking on clients, and we do have great inventory now, because a number of designated growers, recognizing they're not getting into the system, if their plants can pass QA, we're able to purchase them, which is really taking our inventory levels way up.
So the question is, will the 6 licensees or 7 licensees or how many, 8 now, it's growing by the day, be able to supply those 40,000 units and growing, particularly if the new legislation means you can't grow your own? Sarah, do you grow your own, or is that going to be a problem for you?
I do. I do, and I have for years, and I've been a license holder since 2005. So for me, this changes drastically access. And I watched an interview with a fellow who's an MS patient, 3 children, he's 40, and he was saying his bill, should he have to buy it, will be about $35,000 a year. To invest in plants enough to provide your medicine for a year is nominal.
We came out recognizing this is a significant factor, and if you are on disability, we will subsidize your medicine for 50%.
Otherwise, I think it will drive it the other way, and you may have producers outside of the legal thing, producing
that's
for
why they're
lower costs, because the market will drive your price.
At the lowest price I've heard.
Tracy?
I mean, I already pay for my insulin, my syringes, my blood test strips. It already costs me, as a diabetic, $800 a month to breathe. That. Now my cannabis costs, you'd have the lowest price at $4 a gram, which is what I heard from Tweed Inc., is an additional $420 a month.
So I understand the legislation that you'll be able to grow dried marijuana only. So not tinctures, not creams, not cookies, not
And Health Canada recommends eating cannabis, even though
they don't allow us
Alan,
to actually...
why is that a stipulation, given that...
They're afraid of their own shadow, that's all. That will change. You know, it was the same thing when they legalized gambling. They kept dice games, craps away. They said that's too dangerous. So the casinos freaked out, and after 3 years, they lobbied the government. So this program will eventually move to derivatives and tinctures and edibles, because Health Canada has a very strong non-smoking policy. So they're going to have to wake up and understand this.
I have a very non-smoking policy.
A lot of people do.
I can't actually smoke and do my job.
Well, and also the hospitals. How do you bring this medicine into a hospital in a different formulation? The last surgery I had, Mount Sinai allowed me to use edibles. They kept it locked up with their other drugs, and at the end of my stay, they said I used much less morphine because synergistically they work together. One will boost the other, so you can bring your morphine down. But that was edibles. Lockbox, double key, 2 nurses bringing it to me. It was ridiculous.
Stay with us more on the question of legalizing marijuana in Canada.
I'm actually not in favor of decriminalizing cannabis. I'm in favor of legalizing it, tax and regulate. It's one of the only ways to keep it out of the hands of our kids, because the current war on drugs, the current model is not working. We have to use evidence and science to make sure that we're moving forward on that.
There's so much I worry about as a mom. Justin Trudeau's plan to make marijuana legal certainly doesn't help. Imagine making it available just like alcohol and cigarettes. He's sending the message that recreational drug use is okay. That's the last thing I want my kids to think. And making it easier for kids to get? Doesn't sound like Justin Trudeau has the kind of judgment we need in a prime minister.
So there you go. That's very two different views. Conrad, what do you think? Is Stephen Harper playing little political suicide here by going after Trudeau? I mean, public sentiment is in favor of decriminalization.
I think what he's doing is insane. I've been a supporter of him and his government, but I think this is absolutely mad. But I thought that about, building prisons when we have a declining crime rate. I don't know what they think they're doing, pitching to a law and order. Build and they will come. Yeah.
Keep in mind that Stephen Harper has done more for cannabis than any other prime minister.
This is possible, but
he's made it accessible. It's now, if you're sick, you can get access to it. It's now generally easy. The plan is to make it generally affordable.
I think that was Alan's fault.
No, I would disagree.
Well, I mean, he's done more than Chrétien. He's done more than Martin.
Look, we tried to achieve legalization through the court process because the political process is just dysfunctional. And the bottom line is, I worked really hard for about 15 years on this, and it's funny, now I've stopped working on it. They're going to change. Once Harper's gone, they're going to change. Look, when the great gulag down south is legalizing, and they were the big impediment to the Liberal government changing the law, we know this is going to happen. Now, Harper's boxed himself in. He's made too many negative comments about not liking Lucy in the Sky with Diamonds and all that stuff. So he can't change it without looking foolish. But the next person stepping in, looking at $11 billion in revenue for a product that has not injured Canadian society, it's a done deal.
There goes the deficit. So, but Mark, you in the strictly medicinal marijuana world sort of pull apart from the whole legalization movement, right?
No, not at all.
No?
I think that there's an evolution. So us as the first commercial producers, we deal with medicinal, and part of medicinal is harm reduction. And there's also potential people have deficiencies, so they may not have cancer, and they're dealing with trying to stimulate appetite, but maybe PTSD, and there's greater need for them to have access to. The future of recreational decriminalization or legalization, there still will need to be some controls until we have the proof and evidence that it's not going to harm kids, that there aren't going to be further abuses. But it doesn't mean the heavy regulation like there is now, but there will be a new form where we control on some level the efficacy, the cleanliness, the standards that are in place now, and also where they're sold and how they're sold.
But will
Matt,
there always be
You're going to run for
recreation?
mayor. Is this part of your platform?
The response for like Colorado and Washington, a 20% increase at the polls just because of marijuana was on the ballot. Right. And that's my thinking, that because marijuana was on the ballot, more people came out. So if a marijuana person was promoting civic ideas that people who would be in marijuana would vote for that guy.
Right. I understand in Denver there's more dispensaries now than Starbucks.
In California,
Yeah, that's
California,
true.
that's always been true.
Yeah.
There's
Wow.
actually more medical marijuana dispensaries in the state of California.
The biggest
not
cash
medical.
crop in California by far.
In Denver, that's 21 and up. Anybody over the age of 21 and older in Colorado can buy marijuana.
Conrad, when I hate to be personal here, but I'm going to ask you a question about prison. When there's a whole drug mule, like people in prison can still get what they're after. How does that work?
The fact is you can get what you want in an American prison, and it all comes in through the correctional officers. But you referred to the American Gulag. I mean, the United States is a great nation, but its justice system is absolutely abominable. And when I was a guest of the people of the United States prior to being released, when the U.S. Supreme Court concluded that the statute under which I was prosecuted was unconstitutional, a decision they'd come to before, by the way, but the Congress ignored it. One of the things I discovered was that they occasionally managed to get a big drug dealer extradited from a Latin American country just by putting the muscle on that country. And what happens is they have a thing called the Section 35 where they say, all right, the organization goes around and finds some peasant or fisherman or something and says, look, we'll give you $50,000, we'll take care of your family, and you are going to drive a boat or a truck into a drug bust. You won't be hurt. You'll be sent to 6 years in a medium or low security American prison. Frankly, it's more comfortable living than what you have now, and we'll take care of you. Don't worry about it. And then the prominent person gets a 5-year reduction in sentence, and there's a decent interval, and he does it again. It's a scam. Like every aspect of the war on drugs, it is a scam. When I was there, I met everyone from the former Don of the Genovese family down to a guy who stole airplanes to be used for importing drugs. When I asked him once at the lunch table, what's your occupation when you're not here? He said, I steal planes. I mean, just like, you're saying I'm...
I sell shoes.
And down to people who aren't users at all, who were driving a truck full of marijuana, and they were caught, and they were sentenced to 10 years in prison. It is a complete fraud.
I'm particularly interested in the law and order thing. I mean, my dad was a detective sergeant, so when I heard the police chief say that, give him a ticket instead of arresting, if a person has 30 grams or less. I mean, they say not to legalize it, but...
Well, how can the chiefs of police be talking about recreational use when we haven't decriminalized or legalized yet? How can they be talking about that?
The police hate the law. They hate enforcing this law. They hate screwing up young people, okay? But they don't want to give up the law because they get millions of dollars in a budget to enforce the drug law, and 70% of drug law enforcement is cannabis, not cocaine and heroin. Yep. So they talk out of both sides of their mouth. They want to get rid of the law because they don't like it, but they sure want the money that goes with it.
The budget in Canada for drug enforcement, I believe, I think it's probably an old stat, I believe I heard back in the day, it was like $500 million. But $400 million of that goes to cannabis.
Right.
Which means leaves 1/5 to go to crack, cocaine, and all those other harmful drugs, but 4/5 of that budget in Canada is going to cannabis.
We're going to have some more on that when we come back in just a minute. Today, and very quick, final words. What do you think the future will hold as a result of the legislation?
Legalization in 10 years.
Ultimately, Dr. Schechter?
Physician discomfort, but hopefully ultimate acceptance as a tool in our toolbox.
Trace?
I think the patients are going to suffer throughout the first part of this process. I think that's the only people that are going to suffer from this. Businesses will make money. The government will make money. Patients will eventually be taken care of through legalization, I'm hoping, in less than 10 years.
I never said it in my entire life, but I agree with the legalization in 10 years. And that will actually solve the medical issue, too, because if someone wants to medicate themselves by growing for themselves, they'll be able to do it under a legal regime.
I'd say legalization within 2 years, and I hope
if Matt is mayor.
That's right. That's right. He's got an accelerated timetable here.
but under the MMPR, I really want people to have better access to medical marijuana. I think we need people to have better access to medical marijuana.
I see it I'm with you. I see it very soon in the next 5 years. And I'd like to see different formulations come in that people can use in different situations, as we can't inhale everywhere. So there has to be something else that will have the same efficacy.
Mark?
We're going to have a new cannabis, a new industry, a new understanding of this and how it evolves, whether it be legalization or some controls. But we'll have an educated opinion collectively as a nation, as individuals, as physicians, and we'll have much better guidance as a result of this new legislation now.
Yeah, I mean, further to what Mark said, I think it's just important to know as much as we possibly can and to put marijuana under the same stringent regulations that we do with all of our medications.
The question
Last
is,
word, sir.
The question is the legalization of...
Well, just what do you think is going to happen as a result of the...
No, I was, but I got confused. I was listening ardently, but the answer kept changing around. But okay, I will put it in stages. Yes, of course, legalized medical marijuana and more, as particularly Tracy and Sarah have said, more accessible to people who need it. And then I agree with Alan and others that the marijuana generally be legalized, but I'll take it one step further. It won't be 10 years, it'll be longer than that. But eventually, all of it's going to be legalized with obligatory treatment for hard drug addicts, because the whole thing is nonsense. The entire program is a failure. And some of it is a good faith failure, and some of it is just rank hypocrisy and corruption. But it's a failure, and it'll fall, like all failures do eventually, and be replaced with another initiative. But as it is now, our drug laws, especially in the U.S., but here as well, make prohibition, which we never entirely had in Canada because Quebec wouldn't stand for it, but that they had in the United States, will make it look like inspired public policy.
Well, and you have a talk block coming up on that very shortly, which we will hear. I want to thank everybody. That was a fantastic discussion, and we look forward to the legislation coming in. Well done, Alan, for moving that along. On April 1st, I don't know why it's April Fool's Day, but there you have it. We're going to be back with more on the Zoomer.
That today's young innocent faces will be tomorrow's clientele.
Welcome back. I have the honor and privilege of standing right next door to Misha Berger-Goshman, who is one of Canada's most celebrated sopranos. You're on tour, Porgy and Bess, you're putting records out, you were just in Europe, you had a baby, you had some open heart surgery, and then you made a bucket list.
That was just last week.
Well, yeah.
And now I live, deep in the country in Nova Scotia. You can't find me. You can try, but I will see you coming from like 2 kilometers away.
And you have spies, right?
I have spies. They're called the squirrels are my spies.
Yeah, right.
So yeah, no, it's been good. And my little boy, Shepherd, is the most perfectest, most beautiful piece of, I just want to eat him every single day.
And no mother has ever said that before.
No, he's literally the best baby ever.
Well, what are you going to play for us now?
Topher and I are going to sing a little surprise for a topical surprise.
All right, then. Ladies and gentlemen, please welcome the fabulous Misha Berger-Goshman.
This is a little gem that I feel is quite appropriate given the subject matter.
When the shades of night are falling, comes a fellow everyone knows. It's the old dope peddler, spreading joy wherever he goes. Every evening you will find him around your neighborhood. It's the old dope peddler doing good while doing good. He gives the kids free samples because he knows full well that that today's young innocent faces will be tomorrow's clientele. Here's a cure for all your problems. Here's a good thing for your ills. It's the old gold peddler and his homegrown happiness.
You're welcome. You're welcome. Topher McShevsky, ladies and gentlemen. Thank you so much.
The best solution to the drug problem would be to legalize all of it, but require hard drug users to register and submit to treatment. The government's announced hardening of the legal penalties for marijuana use and sale are a disappointment, though not a surprise. This government has a distinguished, or at least a workmanlike record in most areas, but in categories that could be broadly described as law and order, it has been primitive. The American war on drugs has been a disaster in which $1 trillion have been wasted, 1 million people imprisoned and over-sentenced, and the illegal drug industry has grown stronger and more dangerous. Canada has not emulated the tawdry political farce of the United States, but has continued to pander to reactionary sentiment. This was evident in the nonsensical commitment to build unneeded prisons as our crime rate declines and the stupidity of incarcerating nonviolent people becomes more obvious to everyone except a few knuckle-draggers. The best solution to the drug problem would be to legalize all of it, but require hard drug users to register and submit to treatment. It would cut the cost of official drug policy by 2/3, vastly increase the number of cures, redirect billions of dollars into respectable commerce, and financially slice the most dangerous criminal elements off at the ankles. It may be that marijuana is, as the criminalizers never cease to claim, the gateway drug. But the barbarians have torn down the gate and the whole fortification and are at loose in our midst, enriching the world's most violent criminal elements with scores of billions of dollars every year. Marijuana is one of the leading cash crops in the western U.S. states and British Columbia, and more than 50% of Americans and nearly as many Canadians have used it. As in most public policy areas, what is needed is a little original thinking.
Well, after that intoxicating discussion, we've got some exciting news. The Zoomer is going to continue the marijuana debate tomorrow, Tuesday, February the 25th, with a live chat at 1 p.m. Eastern Standard Time. We're going to look at the implications and challenges of legalization, and we want you to participate.
That's right, Denise. I must say that I'm intrigued to see how it will go. You can send your questions ahead of time via email, Facebook, or Twitter. Twitter.
Right, Twitter.
That's what all the young people are using.
That's right. And hop online at 1 p.m. tomorrow at thezoomertv.com for a chance to be part of the conversation.
I will not ask what a Twitter is.
Well, I'll tell you later anyway. Let's zoom out, everybody.